welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look at today's top health news. In a striking revelation, the results summary of the DNB DrNB final theory exam has pointed out that less than 20% of aspirants have cleared the exam in specialities including nephrology and orthopedics. The pass percentage in specialities such as hospital administration, Otorhinolaryngology, Paediatrics, Pathology, surgical oncology and emergency medicine is not so good as 40% of the total candidates have cleared the exam this year. As per the data revealed by the media, the pass percentage is below 50% in several other specialities including anesthesiology, and less than 60% of the people pass in specialities including microbiology, nuclear medicine and pharmacology. Apart from these, the pass percentage in cardiovascular and thoracic surgery 65%, 63.46 in cardiology, 68.16 in general surgery, 63.64% in medical oncology, 65.32 in ophthalmology, 62.5 in physiology, 65.9 in psychiatry, 66.9 in radiodiagnosis and 66.13 in radiation oncology. However, specialties including pediatric cardiology, medical genetics, clinical hematology, clinical immunology and rheumatology, physical medicine and rehabilitation, pediatric surgery and neonatology have 100% pass percentage. More than 90% people pass in urology, plastic and reconstructive surgery, and almost 90% candidate clear exams in obstetrics and gynecology. If the pass percentage of December 2020 is taken into account, then there is a major drop in the number of people clearing the exam in case of orthopedics. Also, the pass percentage of DNB Paediatrics has been consistently low over the last 3 exams. The media also adds that the doctors have received assurances that taking the hardship and disruption during the COVID era into account, consideration would be given while conducting the exams and evaluating them. However, the students claimed that looking at the pass percentages, it is quite obvious that not only the paper was unreasonably difficult, but the evaluation process had been harsh as well. On the other hand, the NBE officials put the blame of poor results on the poor preparation of the doctors during the COVID times. However, those pursuing their specialization in orthopedics pointed out that if COVID was the responsible factor, then the results would have been poor in all the specialities. However, in specialities such as obstetrics and gynecology, dermatology, general surgery, ophthalmology, radiodiagnosis and psychiatry, the pass percentage has been quite impressive. Speaking to Medical Dialogues regarding the issue, Dr. Rohan Krishnan, the president of FIMA, said this issue has been troubling the young doctors and that is why DNB is taking a back seat over the period of time, and if the government or the NBE doesn't do anything to rectify these problems, people will stop opting for DNB courses. Even less than 20% passing percentage in orthopedics is very shameful because in MD/MS the passing rate is above 90%. The training is done right because these are all credited hospitals giving DNB training. There are 2 things that need to be considered for this. First, usually the candidates do not get their own centers. Further, it is also very shameful that some of the senior doctors have prejudices in their mind that these doctors are not studying well and they are not good in their studies because they choose DNB after not getting MD/MS. When asked the reason for such poor results, he added, "It is very easy to blame the doctors, but it is not the correct way of thinking at all. Some doctors have their own reasons to opt for DNB courses when one part government is saying that MD/MS is equivalent to DNB, and on the other hand, when the passing percentage cannot be even compared, it becomes very confusing. The government must take proper steps and we should think whether we need to recheck the accreditation given to the private hospitals for running the DNB courses. The course needs 3 years to complete. The pass percentage is also so poor, and also the wage that the doctors get is far lesser than the MD/MS doctors. So if nothing is done, people will stop choosing the DNB courses." Thank you and stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.